What we're seeing is a significant spread. Susanna alluded to the stoplight report on the DPS website. It's a great snapshot in time that shows the trend across our county for the rate at which cases are increasing, the rate of transmission is increasing, and the positivity rate, so the rate at which we are getting positive tests for the people that we test for COVID is also going up. Since we've been looking at these indicators collectively, we've not had a scenario where all three were going up at the same time. And so the way we use that stoplight report is to convene our team and to discuss what those metrics mean. The decision was made that there would be considerable amount of disruptions in in-person learning if we were to return at the middle school and high school levels, meaning there would just be more cases than there had been in the past, and it would mean that more kids would have to quarantine as a result of being exposed. One of the other things we've seen commensurate with that community transmission rate is the rate of COVID cases in school-age kids, but most especially amongst our high school and middle school age kids, it's gone up above a level that we've not seen for several months. Just speaking to the fact that if we were to reopen those age groups, we would have more cases in our classrooms. So we thought it prudent to pause and to reassess in a couple of weeks' time to see if our community mitigation measures will bring those rates down and allow us to bring kids back into the classroom. We're hopeful that through other mitigation measures in the community that those rates will stabilize and come down, and we will have an opportunity to bring kids back into school. Because as a pediatrician, we've been advocating very strongly in the pediatric community to have kids in school. We think it's incredibly important and think that we need to work very intentionally towards that goal. It's just that at the moment, the rate of rise in the community is significant. One of the things that we have learned on the pro side of bringing kids back to school is that, as we've seen around the world, the same is true here in Colorado, that the spread of COVID within schools, when we follow the mitigation measures of wearing masks and spacing, is very, very, very low. So the reason not to be in school is not necessarily the risk of spreading COVID amongst students. The risk of being in school is largely around having to start and stop again. The quarantining that happens when you do have a case in school that causes lots of kids to have to go home, and the difficulties of doing education in fits and starts. And what we saw over the last 2 weeks with the significant uptrend in cases and transmission is a rate at which those disruptions would happen very often. And one of the things that's different about Denver is, unfortunately, COVID is not equal across all populations. I think it's been well documented across the country that families who live in poverty and Black and Latinx populations are disproportionately impacted by COVID. And those populations are highly represented in Denver public schools. And so our case rates in some of our communities are significantly higher than some of the surrounding areas. And so we have to pay attention and be sensitive to that population and the experience that's going on in those neighborhoods, and recognizing that as those case rates go up, so too will the case rates amongst our students. And so the likelihood of having a positive case in a school goes way up. Thus, the likelihood of having a disruption and having to stop schools based on a quarantine goes way up. And so trying to make sure that we can bring kids back safely, but also efficiently in a way that is predictable for both children and families is also important. And so those are all the factors that we're weighing when we watch and track these metrics so closely.